Hello, and welcome to Kaweah Delta's online town hall. My name is Deborah Volison, and I'm the Director of Community Engagement for Kaweah Delta. This is our 5th town hall, and we are coming to you live from the Graduate Medical Education classroom up on the 5th floor of the Support Services building. In just a minute, I'm going to bring in Kaweah Delta's board president and our hospital CEO, but first I want to go over a few logistics of tonight's event. Right now, we have live attendees joining us on the webinar, Facebook, our Spanish Facebook, and Instagram. Several community members have also sent in questions in advance, and we are going to cover those. Our webinar chat feature will be live the entire meeting, so feel free to chat at us, and we will incorporate your questions into the discussion. You can also ask questions on the 2 Facebook Lives and Instagram Live. We have moderators on all of these platforms ready to get me those questions so that we can address them in this forum. Please refrain from using confidential patient information in your comments or questions. And if you have a concern regarding a patient care experience, our moderators will make sure you have the contact information for our patient experience team. Most importantly, though, please be kind and respectful to us and each other. Kaweah Delta is not a political organization. We are here to give you information on our hospital, and we want to make sure that our local community has confidence in our organization and that everyone has access to our services. The transcript and video of this town hall will be posted on our website within 24 to 48 hours. At this time, I'm going to welcome Nevin House into the room. He represents Zone 5 of our healthcare district. He has served on the Kaweah Delta board since December of 2016. He's active on several board committees, which include audit and compliance, community-based planning, finance, property services and acquisitions, marketing and community relations, and patient experience here at the hospital. He also has served on the Kaweah Delta Medical Staff Joint Conference, Sequoia Integrated Health, and Tulare King's Cancer Development. Nevin, please come on in.
Hello. I'm Nevin House. I've been on the board, as Deborah mentioned, for almost 4 years now. Been the president of the board for almost 1 year, and during that time, I have worked with many of the people here at the hospital, and they are by far one of the finest groups and dedicated to the health and taking care of the people of this area. We're doing this urgent care. We're doing this town hall so that we can reach out and hear the questions from the people. We can answer the questions, and we can be as transparent as possible. That is one thing that the CEO has dedicated himself to doing, and we have made it a primary goal of ours to do that continuously. Now, in a second, I'm going to introduce our CEO, but before I do that, I wanted to see, since I have some specific levels of areas of expertise due to my secret identity job that I do in my daytime, is there any questions that relate to what I do?
Well, Nevin, we received a question about different types of masks. Are some better? Should we use disposable masks? Do you have information that you can give us on masking?
Well, that's an area that I work in every day in terms of not masks themselves, but in the realm of very small things. I do a presentation where I call the power of small thinking. And what I've done in that is let people know what goes on down in the area where things are only visible with a microscope, and then even down into areas where you cannot see things even with a microscope. And that's where masks are actually working, and that's why there's a lot of misinformation about masks out there that I would like to try and correct at least a little bit of it. One of the things about masks is there's a certain hierarchy of the masks. You have the N95, which are pretty much dedicated to medical personnel. They do the best filtering of everything both in and out, so it doesn't go through the mask if they're properly fitted. The next one you have then is the surgical masks, which are worn by most of the hospital employees at all times. Then you get the cloth masks like you will see on people at grocery stores, although you will see a few of the N95s and the surgical masks also. And then you get into the let's call it the inexpensive masks, almost just kind of punched out or cut out of just a single layer of cloth. They do all perform differently, but they have certain things in common. One of the misconceptions about all the masks, and you'll hear this, is that the COVID virus is too small to be stopped by the masks. And that's somebody who doesn't fully understand what happens down at very small sizes of both the virus, the openings in the masks, et cetera. What I did is I worked to come up with a multiplication factor that kind of made things understandable. And I found that if you take everything associated with masks, the size of the openings, the COVID virus, et cetera, and you multiply it 130,000 times, it gets a lot easier to understand than talking down in nanometers and picometers and things like that. So I took and I multiplied everything by 130,000 times. And when you do that, the COVID virus ends up being the size of a marble, a standard marble, 1/2 inch. Everyone knows that size. Now, people will tell you that the mask openings are about the size of the openings in a chain link fence, and that's true. If the COVID's the size of a marble, the mask openings are about the size of a opening in a chain link fence. So it would seem like you could throw the marble right through there. But what that ignores is that the mask is not two-dimensional like a chain link fence is. When you blew up the diameter of it 130,000 times, you also blow up the thickness of it 130,000 times. So that mask does have openings the size of a chain link fence, but they are 170 feet long in a standard mask, and they wind around and they twist and all of that. So that marble has to go all the way through 170 feet of winding tubes to get to the end, and during that time not touch the sides, because if it does, it's going to get caught in the mask. Now, to make it even more difficult, when you get down into particles that small as the virus, there is a phenomenon called the Brownian effect, which is because of air currents, et cetera, they don't travel in a straight line. So the virus does not go in a straight line, it actually zigzags as it goes, so it's going to definitely hit the sides of that mask. So we have those things showing that it's not easily going to go through the mask. The next thing is that when somebody coughs, sneezes, talks, sings, whatever, and has a mask on, the virus does not come out in a single virus particle just out there floating in the air by itself. It comes out on a bit of moisture that comes out of the person's mouth or nose. These moisture particles are much, much larger than virus particles. So what you have is not a virus particle floating around by itself. You have a virus particle that is inside of something the size of a basketball or a beach ball. So if you can imagine trying to throw a beach ball through this chain link fence that is 170 feet thick, you get the idea of how difficult it's going to be for that to go through there. So now we run into the next section, and that is people talk about how difficult it is to breathe, or that it's going to cause carbon dioxide buildup. Well, if we use that same 130,000 time multiplication factor, the oxygen molecule is, in a comparison of size, it's 1/5 the thickness of a standard human hair. Now, the human hair, we know the thickness of it. We've measured it. I have measured it. I didn't use any of my own hair to measure it. I didn't have any to spare, but I had people donate hair so I could measure the thickness of a human hair. And it works out to about 100 microns. If you blow up 130,000 times, the oxygen molecule is only 20 microns. So it easily traverses the tubes to get back and forth inside the mask and out. A carbon dioxide molecule is about double the size. It's about 300 microns. Still easy to go through. That's still, 30 microns. So that is still only 1/3 the diameter of a human hair. Easily going to go through those pathways. And because they are gas molecules, they don't stick to the sides if they touch them. In fact, there's openings in the sides where they will actually pass through and go from one tube to the next tube to traverse that 170 feet. So the masks do help. They don't stop everything because you're still going to have something come out the top, the sides, the bottom, but it stops a majority of the virus if somebody is positive and coughs, talks, and even stops the majority of it coming in. So they do make a big difference, and please wear masks. Is there any other questions for me? Or
No, thank you very much,
Well, then I'm going to introduce our CEO. He's been CEO for about 3.5 years. Gary Herbst, he is an amazing man, and he has a knowledge of the day-to-day running of the hospital that I cannot begin to touch. and he can help you understand exactly what's going on and answer all the rest of your questions. Thank you.
Well, thank you, Nevin. I'm glad I didn't have to field the mask question because I was just going to say, masks are good for you, please wear one. But yours was much more convincing than mine was, so thank you for that. And thank you to all of you at home this evening joining us. We always greatly appreciate and value any opportunity we have to interact and engage with our community. To help you know more about us, to keep you well informed about your community hospital, but more importantly, to really listen to you and to learn from you the things that we can do to become a better hospital for you and to better meet your needs. So thanks for being here. As Deb mentioned, this is our fifth and final town hall meeting of the 2020 year. Although I think we've already made a commitment that going forward, we intend to hold many future town hall meetings. Hopefully, we're doing it physically together and not virtually. Sadly, this is the third virtual town hall meeting that we've had to do. Fortunately, Lynn Havard-Mervis and Dave Francis hosted the first two town hall meetings, and it seems so long ago when we actually got to meet in person. But hopefully you still find this evening informative and valuable, and again, thank you for taking the time out of your busy lives to join us. So I know that our lives feel completely consumed by the coronavirus pandemic, both professionally while we're at work and while we're at home. And I will devote the majority of our evening tonight answering the many questions about coronavirus that you have posed to us in advance, but also fielding your questions as they come in. But I would like to spend just a few minutes, and John Knutson always puts me on the clock. He gives me probably no more than 5 or 6 minutes, but just to hit some of the highlights, some of the non-COVID things that are going on at Kaweah Delta, because despite COVID, which does consume a significant amount of our time, we continue to do some really amazing things for your community or our community through your hospital. So I'll start. One of the most exciting ones is the expansion of our emergency department services. So back in 2019, we completed construction of our 8-bed fast-track unit, what we call Zone 6, for low acuity patients, fast turnaround. We try to get you in and out as quickly as possible, and that really took some pressure off of the primary emergency department. And then just several months ago, we completed the 9-bed unit on the north end of the ED, that what we call Zone 4. So that helped to increase the capacity within the ED. And then lastly, Zone 5, which is the major project that you see going on out in the east parking lot. And it actually is starting to look like a building now. So if you drive down Locust or Mineral King, you actually can see what the new emergency department is going to look like. So that's on track to have construction completed in April of next year, and then we hope to occupy by June. And it literally, when all 3 of those phases are done, it will have doubled the size of the number of exam rooms we have and the size of the waiting room. Also have some late breaking news. I just learned of it this week, and Dr. Kona Singh, the medical director of the ED, asked me if I would just share this with you tonight. In a couple weeks, you're going to see us start taking down the tents. They're out in the parking lot in front of the Mineral King Wing entrance. So those tents have been kind of auxiliary tents to the emergency department, primarily put up in reaction to the pandemic. We also have a number of C trains out there where we actually have laboratory and imaging. So those will all start to come down, and we will move all of the ED outside operations will now come inside. And so the waiting area and everything. But we also will close down that Mineral King Wing entrance. And this is all being done to help us, move forward and complete that construction by April of 21. So look for that coming. We also continue to make great progress on the development of our 5th rural health clinic, this one in the city of Tulare on the corner of Prosperity and Mooney. We hope that will be open in early spring of next year and bring expanded primary and specialty care services to the community of Tulare. So very excited about that. And then just a couple weeks ago, the federal government, the Health Resources and Services Administration, which oversees primary clinics, they did a virtual survey of our family medicine clinic located on the 5th floor of 202 West Willow. We have applied for that clinic to become a federally qualified health center. And that survey could not have gone better. So we are anxiously awaiting the news that we will be certified here in about another month or so, and that will greatly enhance the reimbursement that comes to Kaweah Delta for taking care of Medicare and Medi-Cal patients, which is then used to help recruit new physicians into our community. It's hard to think of anything positive that's come out of this pandemic, but the one thing it has done is really kind of accelerated hospitals' ability to develop new services, expand facilities, really kind of suspended a lot of the very strict administrative surveying and certification requirements and processes. So as a result of that, we actually accelerated the completion of the 5th and 6th floors of the Kaweah Wing Tower. So the 5th floor is a 24-bed intermediate critical care unit. That unit couldn't have opened any sooner because we literally have 23 patients in those 24 beds today. So hard to imagine what we would be doing if we didn't have those additional beds. And then the 6th floor is a brand new 23-bed neonatal intensive care unit. We have 14 neonates that are on that unit right now. Moms and dads and staff just absolutely are thrilled by having those beautiful, large, private rooms. So really excited to have those completed. Also very excited to have celebrated our 3rd year anniversary with our partnership with Valley Children's Hospital, who their pediatricians and neonatologists staff our NICU and our pediatric unit. They respond to the labor and delivery unit, the emergency department. So it's literally like having Valley Children's highly skilled, trained, and educated physicians right here in your local hospital. If you can keep a secret, and apparently I can't, because I'm going to tell you something I'm not supposed to tell you, but Health Grades is a renowned consulting company that grades all the 4,500 hospitals across the United States on multiple different clinical measures, mortality rates and complication rates and so forth. And it also ranks the very best hospitals out of those 4,500. So we just learned, and it will be publicly announced later this month, that Kaweah Delta will be named for the 3rd year in a row one of the best 250 hospitals in the nation. So we're very proud of that. We don't take it for granted. We know that we need to continue every day to get better and better, but it's really nice to see those efforts recognized. We continue to be very excited about our affiliation with the Cleveland Clinic. A renowned cardiovascular institute, has been rated the #1 cardiovascular hospital 26 years in a row. We became only their 2nd California affiliate just a couple years ago, so very excited about that. And another secret, very excited that in October we also, for the 4th year in a row, will be named one of the best 50 cardiac surgery programs in the country. There are 1,200 hospitals that do open heart surgery, and for 4 years in a row, Kaweah Delta named one of the top 50. We're delighted to bring Dr. Gonzalo Carrizo, joined our cardiothoracic program, joined with Dr. Laheb Araim. He came in December. Very excited to have Dr. Carrizo here. He also came from the Cleveland Clinic. Again, sadly but excitedly, this last June we celebrated, unfortunately virtually and through posters, the graduation of 35 of our physician residents across a multitude of different residencies. We weren't able to do it in person as we've done every year before at the convention center, but hopefully we'll be back next June where we will actually have our largest graduating class. And always exciting is that 40% of those that graduated have decided to stay and practice in this community. Just a few days after they graduated, we brought 47 brand new residents came to Kaweah Delta and started their journey to become full-fledged doctors. So excited about that. And on an important related note, I don't think I've shared this in the past, is I just recently looked back over, say, the last 4 years And we have added more than 260 physicians to the Kaweah Delta medical staff over the last 4 years. So that is a tremendous accomplishment for an area that has really struggled to attract and retain physicians. The San Joaquin Valley has one of the lowest physician-to-population ratios in all the state. So very exciting to see so many physicians want to come here and work here. On that same note, very excited about our formal affiliation with the USC School of Medicine. Last year, we entered into a formal affiliation agreement where their medical students now rotate through Kaweah Delta, and vice versa, our medical students and residents can rotate through USC. So I want to thank Dr. Lori Winston and Mark Mertz for facilitating that really important partnership. And then lastly, Kaweah Delta just learned, again, a few weeks ago, that we were awarded a multi-million-dollar behavioral health grant, a very competitive grant that we had applied for to give us the funding to significantly expand our mental health services, particularly in the outpatient area. Kaweah Delta operates a 63-bed acute psychiatric facility, incredible psychiatrists. We have a psychiatry residency program, wonderful faculty, but there's been really a terrible shortfall of just outpatient mental health services available in our community. So this will allow us to greatly expand access and availability of mental health services to both adults and adolescents. So we're really excited about that project. We're in the planning stages right now, and so look for really great things to come. So that's my update.
Good
John,
job.
I probably went over 5 minutes. Oh, he says 9 minutes. Okay, well, it's my best. So I'm ready to devote the evening to all the questions that come
All
our way.
right, wonderful. Okay, so let's go ahead and get started. A community member visited our imaging center on Cypress and noticed that there were signs about social distancing, but the chairs were not separated and patients were sitting right next to each other. And so how would you like to respond to that?
Yeah, I heard about that myself, and I was disappointed to hear that because we obviously take this very seriously. We want to protect our patients and protect our staff, and so when I was in the imaging center, we had set up I guess like a bulletin board or something in the seat asking folks not to sit there so that we'd create that distancing between patients. But unfortunately, patients would remove those and sit down anyway. So what we've done now is we've taken heavy tape and kind of crisscrossed it over the seat. It's now quite conspicuous that the seat is blocked out, and hopefully people will recognize not to sit there. But we also have our folks that work at the front desk. They're frequently just observing what's going on in the waiting room and essentially enforcing that adherence to that distancing. So hopefully this does the trick.
Okay. So next question, why are the results of antigen tests not included in California's testing data? So
Yeah.
couldn't that impact the positivity and the case numbers?
Absolutely, and it's a great question. It actually is a very disconcerting answer because the person that asked this question is absolutely correct. If you go to the California CDPH website, they will tell you that for purposes of measuring a county's positivity rate and their daily new case rate per 100,000 population, that the only tests that they will count in that measurement are PCR molecular-based tests. They will not count antigen-based tests, which is very disappointing and actually quite confusing because it is the state that just deployed hundreds of thousands of antigen-based kits to all the nursing homes up and down the state and has implemented orders where we now need to more frequently test our patients and test our staff. So we do that, but those results don't count towards the tiering of the opening of businesses and society. We Kaweah Delta, actually, we run 3 different molecular PCR-based platforms: the BD Max, the Abbott ID Now, and the BioFire. So those are all PCR molecular based. We will soon add a very high throughput PCR molecular platform that is manufactured by a company called Perkin-Elmer. And we actually were the first hospital, the first non-local health department that was awarded this platform by the state. So all the testing technology and really an unlimited number of tests. But it is also a PCR-based test. It's the same equipment that the state is using to set up what they're calling a super testing center in the town of Valencia. So they are working on establishing that super testing site with the goal of performing 150,000 tests per day. So, but that is a PCR molecular-based test. This is coming at a time where we secured 20 Quidel Sophia 2 analyzers, and we now have 25,000 testing kits with a goal of getting to 75,000 and another 20 analyzers. These are the platforms that we've now deployed in Exeter and Dainuba. We've gone live in those clinics, soon to go live in Lindsay, and also at our 2 urgent care centers on Court Street and Demery. It's the platform that Visalia Medical Clinic has been using for a number of weeks. So that's an antigen-based test, and essentially the state, who is encouraging massive testing of counties, is telling us right now that we won't count those tests, that we only count the PCR tests. So again, we find that very disconcerting, in direct, contrast to what the city or what the state has been trying to promote. So we are working with our local health department and the California Department of Public Health to really get that changed. So great question that was asked by one of our readers.
Yeah, thank you. So can you compare how many deaths resulted from the flu versus COVID?
Yeah, so fortunately, the number of deaths that are being reported by the county, for Tulare County, has remained relatively the same for a number of days now. Today they reported again that since the beginning of the pandemic, we've had 263 COVID-19 deaths since the beginning of the pandemic. The state, for purposes of that tiering and calculating our positivity and daily case rate, is using a total population for Tulare County of just slightly more than 484,000 people. So when you look at 263 deaths and 484,000 people, that translates into a death rate of roughly 54 people per 100,000 population, 54 deaths per 100,000 people. At the same time, what's also held very constant is the percentage of people that test positive for the virus that actually succumb to the virus. The state is running about 1.8%. Tulare County has been running at about 1.6% over the last number of months. When you contrast that with the flu, and unfortunately, there's not an exact number for the flu. When I went on the Centers for Disease Control and Prevention website, the CDC, they're reporting that this most recent flu season that started October 1st, 2019 and ended on April 4th, 2020, that we had anywhere from 24,000 to 62,000 flu-related deaths. Now, that's a pretty huge gap, and that's because it's more difficult to determine that somebody really died because of the flu. Even when we are measuring COVID, we really count those people that came in for the primary diagnoses of COVID. That's what brought them to the hospital. Not that they came to the hospital because they were in a car accident, but they happened to also test positive for COVID. So that's why we have probably a more exact number for COVID. But if you look at that range of flu, 24,000 to 62,000, and we look at the United States as a population of 331 million people. So on the low end, that would translate into just a little over 7 deaths per 100,000 people on the low end, or close to 19 deaths per 100,000 on the high end. So the flu, 7 to 19, and COVID in Tulare County, 54 deaths per 100,000. When I tried to find more recent information about the flu in Tulare County, and the only thing that's available is back to the 2018 flu season. In that year, we had 83 people that died of the flu over that general 6 to 7 month period. So that would translate into deaths of pretty much what the country is on that high end. I said, you know, almost 19 deaths per 100,000 at the high end of the country. Tulare County was at 18 deaths per 100,000 from the flu in 2018. So about 3 times more deaths per 100,000 people in Tulare County from COVID versus the flu. But that's certainly expected. We have a pretty effective vaccine for the flu that either prevents you from getting it, or if you still contract it, it can make your symptoms and your reaction to it much more mild. So it just underscores the importance of us developing a safe and effective vaccine for COVID.
Okay, thank you, Gary. So can you share any information on keeping healthy other than masks, hand washing, and not touching your face? Do you have any information on the effects of exercise, vitamin D, zinc?
Yeah, as I rub my nose and touch my face. Yeah, thanks for that. Good timing from your question there. Well, first, thanks to the person that asked the question. All those great behaviors that you described are probably the most important, the most effective, and that's the wearing a mask, as Nevin really underscored the importance and the effectiveness of wearing masks, but also hand washing and not touching your face. But those other things, they all kind of come down to keeping your immune system really strong. So when I talk to physicians, I talk to nurses, they talk about, you know, all the things that we're told to do. Eat healthy, you know, stay hydrated, continue to exercise. If there are vitamins or foods that are more of those superfoods that really energize and elevate your immune system, you know, definitely those are the things that we would prescribe. Try to get, you know, ample sleep. And I know that's difficult for a lot of people right now, but you don't want to let yourself get worn down. When you're worn down, that's when you're most susceptible to the virus. So it's really, again, it's kind of some of those lifestyle things that we can do just to boost our immune system and protect us against this virus.
Okay, thank you, Gary. So we have a question that's come in on Instagram. How much did the hand wash monitors cost to install?
Yeah, so we rolled it out slowly. We just did a couple units as pilot units to evaluate the effectiveness, but they were so effective, in fact, that we found that our hand hygiene compliance rate went from, I don't know, maybe I'll say 60% to almost 99%. Just phenomenal. So it was pretty convincing because we know that hand hygiene is probably the most important thing we can do to avoid spreading infection, to avoid a patient acquiring an infection in the hospital. So we were absolutely convinced. The final cost was in the hundreds of thousands, I think somewhere in the 300,000, 250,000, I was close, 250,000 to roll it out to the entire medical center. Mm-hmm. So we're going to kind of pause there for a moment and see, you know, really kind of hardwire the BioVigil technology within the acute medical center, and then look to continue to roll that out to other areas across the organization, our rehab hospital, mental health, skilled nursing, those areas as well.
Okay, thank you. And John would also like the attendees to know that it's already saved over 800,000 by reducing hospital-acquired infections.
Perfect. Thank you, John.
Thank you, John. Okay, was overall testing lower in August due to shortages? And if so, has this been resolved?
Yeah, August was lower. July, by far, was the busiest testing month throughout this entire pandemic, which shouldn't come as a surprise because July and early August was when we experienced the significant resurgence of the virus. No surprise that it followed just a couple of weeks after the July 4th holiday, but we found ourselves going from about 30 COVID positive patients a day in the medical center to over 90. And it just grew exponentially. So we certainly were testing a lot more patients that were being admitted to the hospital, that were coming through the emergency department, but we also were collecting a lot more specimens out there in the community because so many more people were exhibiting symptoms and actually contracting the virus. So I think we did about 9,000 tests just in the month of July. That did fall to about 6,000 tests in the month of August, but it wasn't because of the lack of supplies. We did see the virus starting to taper off. We were, far enough away from the 4th of July holiday that it just started declining. But there's no doubt about it, our availability of supplies, particularly on the BD Max and the ID Now, Abbott ID Now platforms, they used to be abundant, then they became scarce. They continue to be in pretty short supply. Although, just earlier this week, we learned from Abbott that their new production facility, I think it's located in Canada, they had some hiccups getting it started, but it sounds like they're now at full production. We received a number of new shipments this week, and we hope to continue to receive them. That's excellent news. Because again, that's one of those molecular PCR-based platforms, and that is kind of the gold standard. That's what we use for testing our inpatients to determine, where they should be placed. That's where we test elective surgeries prior to surgery. So if I talk to Randy Coca, our Director of Laboratory Services, he pretty much said, the decline in tests really has not had anything to do with the absence of supplies. What's interesting is that fell even further in the month of September. We actually fell to, I think, about 5,000 tests in September. And again, not because of supply shortages. So I can only speculate, but the state believes that the number of tests being conducted is a reflection of the frustration of our communities in how long it's been taking to get test results back. So you go to get your specimen collected and you don't hear results back from a commercial lab for 2 weeks to 3 weeks. It's like, why is it worth it? I'm already past the quarantine period, so there's really no benefit of it. And so that's probably been a real driving force. I think because we're 7 months into the pandemic, what we used to call the worried well at the beginning, just people that didn't have any symptoms. They felt perfectly healthy, but they were just nervous. I need to know, I need to know. I think maybe that anxiety has a bit subsided, but I also think it's understandably, people are concerned that if I go get tested and I test positive, then, and even if I feel great, I don't have symptoms, that I'm gonna be quarantined for 14 days at home. I might be separated from my loved ones, or I may not be able to go to work. So I'm just going to take my chances and not get tested, which is really the wrong thing to do. If we're really going to lower our positivity rates, if we're going to move up into the tiers where our businesses and our society can open, we have to do a lot more testing, and we're really hoping that this, again, the Quidel antigen base, if we can get the state to start recognizing that as a legitimate test, but then also the PerkinElmer platform, that will roll out in probably about 5 weeks from now, and we really encourage the community to get, to not fear getting tested. Even if you're feeling well, we want you to get tested.
Okay, thank you. So we have a Facebook comment and a question that has just come in. So someone who attended the board meeting virtually was surprised that none of the board members or staff were wearing masks. He asked, can Mr. Herbst and Mr. House explain to the public why, as elected officials and high-level civic leaders and staff in charge of our most critical health care, they are so cavalier with their own adherence to necessary public health care behavior?
So I appreciate the comment. So every meeting room that we have throughout the organization, including the lifestyle meeting room, which is where we met, There is a stated legal capacity that I think is determined by the fire marshal, what the maximum occupancy is. The state and the county health department have set now, because of the virus, have set the maximum capacity now at 25% of that stipulated maximum capacity. So if that large meeting area had a normal capacity of 100 people, the most we could have in there is 25. If it was 50, the most we could have in there was 12. So we strictly adhere to that requirement of the county and of the state. If you saw, we were all spread out. We now, everybody comes into that meeting wearing a mask. They sit down at their own space, at their own table. Everybody is distanced at least 6 feet apart. When you get up to leave the room, to the restroom or whatever, you put your mask back on as you leave. When we have guests come in, so Monday night, we had the wonderful opportunity to celebrate 2 of our Service Excellence of the Month employees. We celebrated the retirement of Sue Sorensen, a nurse here at Kaweah Delta for 41 years. They all wore their masks when they came in. When we stood by them, we stood 6 feet apart. Their guests were seated wearing their masks the entire time. So while there might be an appearance, maybe you can't, because of your, how you're viewing it, and get the appreciation of dimension and distance. But we are very spread apart and adhering to all of the recommendations of the CDC and the county and the state.
Okay, thank you, Gary. So I want to kind of go back to the last statement you made at the end of the last question. So you are encouraging people who maybe don't even have symptoms to go get testing.
I am.
Okay.
Yeah. I don't know if I'll get in trouble for saying that, but no, I mean, that's the only way we're going to really understand what's taking place in our county, how prevalent is the virus. If you look at the roughly 16,000 people in Tulare County that have tested positive on a population of 484,000, it's about 3.5% of the entire population has tested positive, but only 29% of the population has been tested. So we still have a pretty low percentage of the population being tested. If you only test symptomatic patients, and then I won't say few, but the hundreds of patients that are coming into Kaweah Delta for elective procedures, we also test them, every one of them. If they're symptomatic, we cancel their surgery. If they're asymptomatic, we test them. If they test negative, then they have their surgery. But if we only test symptomatic people, then we're always going to have a chronically high positivity rate unless the virus just literally starts disappearing. Because if you just test symptomatic people, you have a much higher probability that they're going to be positive.
Right.
And so that's why, and with the state's encouragement and the county's encouragement, we want to test as many people as possible. Ideally, you want to test people that don't have the virus, because that will count as 0 in the numerator and 1 in the denominator. If we test an asymptomatic patient, asymptomatic means you have the virus, but you're just not exhibiting symptoms. You will test positive. 1 on the numerator, 1 on the denominator. Does not help our case rate, does not help our positivity rate. So yes, we want to test as many people as we can. We started testing anybody who wants to be tested back on September 14th at our Exeter clinic. On September 21st, we started that at the Dainuba clinic. I mentioned we'll be deploying those Quidel platforms out to other clinics. All you have to do is call 624-4110, that's the Kaweah Delta hotline, and make an appointment. You drive in. It's not a drive-through that you stay in your car, but you come into an air-conditioned, special C-train where we just do a simple nair swab just in the nostril. That Quidel test comes back in it's a fast test, produces results in about 15 minutes. Although we tend to kind of batch them and test them throughout the day, and you get your results that evening or the next morning. But you can also just show up. drive up to the Exeter Clinic and say, I came here to get a test, and they'll get you in. So short answer, yes, I want to test as many people as we can. Even if you feel well and you're convinced you don't have it, we still want to test you.
Okay, so this is a new message than our last town hall where we were, we did not have
Absolutely.
the ability.
Yeah, because we did not have the Quidel platform. And
Right.
again, bless Randy Coca, he's a miracle worker. We were one of the first hospitals really in the Valley to acquire the Quidel platform. And I mentioned the state actually worked directly with PerkinElmer to acquire 50 PCR molecular platforms and an unlimited number of tests. They deployed 25 of those platforms to the local health departments up and down the state. That gave them 25 more to deploy to other healthcare entities. We were probably the first non-public health department to be awarded that platform and those supplies by the state. And it's being provided to us free of charge. The state is paying for all the equipment and all the testing because, again, they want to see widespread testing up and down the state. So definitely my answer has changed dramatically because when we last spoke, we did not have ample testing supplies. We really were just running on the BD Max and the Abbott ID Now, and that was kind of being squeezed, but that really changed significantly with Quidel, and now with Abbott, their supplies starting to come in, we now have the capability to do much more widespread testing.
Okay, so we're going to stay on this topic for a minute because I have some questions that are coming in on the social media platforms. But I want to be very clear. Asymptomatic people the question is, can they be tested at any Kaweah Delta facility? Which facilities can asymptomatic people be tested at?
So again, I'll just clarify. Asymptomatic means you are COVID positive, but you're not exhibiting any symptoms, which is about 50% of the world population, according to scientists, that about 50% of the people that contract the virus will not experience any symptoms. Those are called asymptomatic.
Right.
But then there is a person
No symptoms.
that not only do they not have symptoms, they don't have the virus.
Right.
And so I would call them virus-free.
Okay.
But yes, whether you're asymptomatic or virus-free, you feel totally healthy, you can get tested now. And you can get tested at our Exeter clinic, at our Dainuba clinic, soon to be our clinic in Lindsay, soon to be our urgent care center on Court Street and Demery. And if you're a patient of Visalia Medical Clinic, they also have the Quidel Sophia 2 platform out there. When the PerkinElmer platform becomes available, that may even increase the amount of testing that we'll do. But yeah, the short answer, symptomatic, asymptomatic, I'm virus-free,
Yeah,
but I'm healthy. But I would just remind people, again, don't have an overconfidence from that, because all that means is you don't have the virus right then. So you very well could get the virus the next day in the grocery store or having some exposure to somebody. So we don't want people to think, okay, I tested negative for the virus, I'm good, I don't have to wear my mask anymore, I don't have to follow these behaviors, and it doesn't mean that. It's great that you don't have the virus, and you know that, and particularly when you're at home, when you're in your own social bubble with your family or friends who are practicing good habits, you know that you don't have the virus at that time. So I just caution people,
Right.
Don't take that as I'm now free.
Right. So what is the cost of that test at the Visalia Medical Center and the site in Dainuba?
So if you're having it done on the rapid result Quidel Sophia 2 platform, which is all those locations I told you, there is no cost for that test. Through a partnership with Tulare County, who received significant CARES Act funds from the federal government through its state allocation, the county is actually paying the cost of those Quidel analyzers and the reagents, the test kits. So there is no cost to a person for having that test done. Now, if you're somebody that comes in to, say, the Exeter Clinic, and you are symptomatic, you're not feeling well, then we'd certainly like a provider to look at you, to have a physician or a nurse practitioner examine you and determine really what's going on with you. So that is a covered benefit. We generally, in that case, we would bill your insurance company for that outpatient visit, no charge for the COVID test itself. But if you have that interaction with the provider, then we'll bill your insurance. If you're uninsured, then there's no charge for that as well.
Okay, thank you. So if you don't receive the rapid test, how long is it now taking to get results?
Yeah, so definitely if you're symptomatic, call your doctor, have them order a COVID test, have it drawn at Kaweah Delta. We just moved our specimen collection site from Floral Street over to Court Street, just on the south end of the Urgent Care Center building. There's another building just south of it that we retrofitted with, created isolation rooms, created negative pressure rooms there. So if you're symptomatic, we'll do the nasal pharyngeal swab, which is the deeper swab, and we'll run it on one of the PCR molecular platforms, and you'll generally have your results again that night or the next day. If you are not symptomatic, again, go to one of those other sites, and if it's a Kaweah Delta site, we can turn those results around again that night or the next day. Even so whether it's the rapid tests or the PCR molecular, if it's done through Kaweah Delta, you're going to get results rather quickly. If you go to your physician or another testing site, so excuse me, Tulare County has set up specimen collection sites in Dainuba and Porterville, I think at the memorial buildings. And so they swab there, but then they send that specimen to Quest Labs, which is a commercial lab. And that's the lab that was taking 2 to 3 weeks to turn around test results. We understand that Quest has caught up pretty well. They've increased their throughput capacity, but results are still taking anywhere from 2 to 4 days. So the question, if you don't have a rapid test done, you have, the non-rapid. If it goes to a commercial lab, it's still probably going to be 2 to 4 days. If it comes through Kaweah Delta, it's really going to be probably the next day.
Okay, thank you. Do you think the uptick in positive staff has anything to do with the newly relaxed standards for testing patients being admitted?
Well, we haven't relaxed any standards. In fact, our medical staff, our clinical staff, we're still using the same medical management protocols that we've been using for months and months. We strictly follow the CDC recommendations. That said, we have seen an uptick. Fortunately, we've had almost 400 employees over the course of this pandemic that have contracted the virus, some of them in the hospital, probably most of them, well, I wouldn't say most, maybe a simple majority contracted outside the hospital. But the uptick that we saw recently at Kaweah Delta, I mentioned almost 400 employees that had been out, only 30 are out today that are actually quarantined at home after testing positive for the virus. So the slight uptick that we saw was pretty much the uptick that we saw countywide, saw statewide, saw nationally. I can't say it was attributed to the Labor Day holiday, but it was a slight uptick, but I don't think they were contracted in the hospital. We follow such strict PPE regimens now. We're so highly trained in disinfection and the wearing, the donning and doffing of PPE, when we might face an aerosolizing procedure and isolation. And we just purchased 30 new HEPA filters to help us, clean the air in rooms. So the likelihood of actually contracting the virus in the hospital has probably been at the lowest it's been throughout this pandemic. So, but that doesn't mean our employees don't get exposed like anybody out there in the community. So
Right.
I think that uptick is community acquired.
Okay, so are healthcare workers regularly tested? An employee who works for Kaweah Delta says it's only done if if they ask for it.
Yeah, so yes and no, in the ever-changing world that we live in. So definitely, if any employee is symptomatic, doesn't feel well, or they think they've been exposed, that somebody in their household or somebody that they spent time with and maybe weren't wearing a mask and that person ended up being COVID, we absolutely want those people to be tested. Now, obviously, we do need the employee to tell us, I don't feel well, I was exposed. So there is that ask, you have to ask to be tested. Well, yeah, we need you to tell us, what's going on, and then we will, at that point, insist that you be tested, because we certainly don't want you at work, it's particularly if you're positive. We want you home, recovering, resting, and at the same time not unnecessarily exposing patients or your colleagues to the virus. So we do testing when it appears to be appropriate. But at the same time, just recently, the state passed a new law or regulation that now requires that we routinely test all of our employees who work in our skilled nursing facilities. So at least once a week, we now have to test all of those employees. So that's now a state mandated, and we will deploy the Quidel platform to our two different skilled nursing facilities, one on Court Street, the other on our West Campus. So that is mandatory testing of our employees. Now, that said, one of the things we also implemented about a month or so ago is we now, every single day, we screen all 5,000 of our employees. Any employee that's physically working at a Kaweah Delta facility, we now screen them with a temperature test. We go through the symptoms, and if anybody, appears to have a temperature or is exhibiting any of the other symptoms, then we do ask that they be tested.
Okay, thank you. So what is the financial health of Kaweah Delta? And have all the previously laid off staff returned, and are you anticipating more layoffs?
I'm glad you didn't ask this question at the end of tonight, because I'd like to end on a positive note, but there's no doubt about it. This pandemic has been financially devastating to all hospitals across the country. Kaweah Delta is not immune to it. This last fiscal year that ended on June 30, 2020, was the first time in our 60-year history that we actually ended the year in the red with an operating loss. We certainly, over the years, we've had a bad month here and there, but generally by the end of the year, we end on a positive note. Not always, achieving our goal, our budget, but it's always been ending in the black, and that certainly was not the case this last year. Kaweah Delta sustained a $32 million operating loss for that 12-month period ended June 30, 2020. Fortunately, because of an act of Congress, hospitals were provided some relief funding, significant relief funding that greatly mitigated that financial devastation across the country. So Kaweah Delta received about $14 million in CARES Act funding over the course of May and June that was counted towards that operating loss that we had for the year. So after taking into account those stimulus funds, we ended the year with about an $18 million operating loss. Again, still unprecedented, but much better than the $32 million that we would have been looking at if not for those funds. We started the new fiscal year on July 1, and obviously today's October 1. We don't know the September results yet, but July and August were similarly challenging. July and August were incredibly busy months taking care of many, many COVID patients, very resource intensive to take care of COVID patients, and also caused us to continue to keep our elective surgeries down so that we could keep inpatient beds open. So for the month of July, we incurred a $2.6 million operating loss. That was followed by a $4.6 million operating loss in the month of August. But fortunately, again, we did receive about $19 million in stimulus funds in the month of July. And we're spreading those stimulus funds over the months of July, August, and September. And so when we take that into account for July and August, we actually turned those 2 months of operating losses into almost a break-even profit, slightly better than that. We actually, for that 2-month period then, after taking into account the stimulus funds, we had a positive operating margin of $194,000. But those stimulus funds run out in September. So we're essentially right now on our own for the month of October and beyond. Although I received an email today from Devin Nunes's office that CMS, the Centers for Medicare and Medicaid Services, has just announced that beginning Monday, hospitals can apply for additional financial relief. Up to $20 billion is now being released. The CARES Act actually appropriated $100 billion in funding for hospitals, but only about half of that had actually ever been released up until now. Well, now another tranche of it, another $20 billion, is being made available to hospitals. So there's an application process that you have to go through to demonstrate the costs you're incurring to take care of this COVID population and the lost revenues that you're experiencing by having to shut down or suppress services. So that was exciting news.
Yeah, thank you for that. So let's go back to the question about the previously laid off staff. Are they coming back or?
No, unfortunately they're not. You know, a combination of staff that we permanently laid off, which was an incredibly, painful thing to do because we've worked so hard to avoid any layoffs. We've tried to make every possible cut we can in non-labor costs so that we didn't have to lay off anybody. But April, May, we were hit just so hard that we had to carefully go through our organization chart and look at positions that, they're great to have. They provide value, but in these unprecedented times, we just couldn't financially support them. Mm-hmm. So those positions have not come back and they won't come back. But then there are also a number of positions that were temporarily furloughed, like the folks at the Lifestyle Center. When we closed the Lifestyle Center down, all of those employees, were out of work. So they were temporarily furloughed. But we also created a labor pool where those employees, the Lifestyle Center in particular, could sign up to be part of that labor pool, and then we would deploy them to other areas throughout the organization that they could work and continue to receive the compensation that they were receiving when the Lifestyle Center was open. So a number of those furloughed employees have come back, and as we continue to open more and more services, we should see all of them come back. But again, we're living in incredibly uncertain times. I know folks would like me to provide an absolute assurance that there won't be any layoffs in the future, and unfortunately, I can't do that, but I can assure people that the board, the executive team, our entire leadership is working incredibly hard and will never stop working to find ways to increase our revenue or cut expenses so that we don't have to lay off any further employees.
Right. So I'm going to jump ahead a little bit because the question came in. There are many misconceptions that we're getting rich off the COVID patients. And so this community member wanted you to clear that up. And I think you kind of did in your previous answer, but is there?
Well, actually, yes and no. Mm-hmm. I get asked that question repeatedly, and it's okay. You think maybe I'd become frustrated by the question? I'm not, because I know it's confusing out there, and I know that misconception still exists. So I welcome every opportunity I can to help people really understand what the facts are. So indulge me for a moment here. And remember, I was the CFO before I became the CEO, so I am still kind of a numbers guy. So I do actually like talking about this. But so since the beginning of the pandemic, which started back in early March, we have admitted 904 COVID-positive patients, where that was, again, their primary diagnosis. That was the reason that they were admitted to the hospital. So as of August 31st, what was the last completed month prior to September, we have fully coded all of the ICD-10 diagnoses codes that our HIM team, which next week is National Health Information Management Professionals Week, so just a shout out all to those great people. But they literally pour through that medical record and they code all the things going on with the patient, all the primary and secondary diagnoses, all the procedures that were done and everything. So by the time you get through all that coding, it's complete, you now bill it to the various payers. We've completed that process for 676 of those 904 cases. 52% of them were covered by Medicare, 28% by Medi-Cal, 18% were covered by commercial insurance or workers' compensation, and only 2% were uninsured. These patients stayed in the hospital on average 10.3 days over the course of their stay, which is roughly twice the length of time that a non-COVID patient that has acute respiratory distress, which is the primary ailment of a COVID patient, is the inability to breathe, that respiratory distress. But a non-COVID respiratory distress patient would generally stay about 5.5 days, so 2 times as long. And the resources that go into taking care of a COVID patient, the intensity of physician care, the intensity of nursing care, all of the PPE, the supplies, the drugs, the remdesivir, the dexamethasone, the intubation, and all of that significantly increases the cost of the care of taking care of that population. So those 676 patients, they cost us $20.1 million to take care of them. It's roughly $30,000 per case for that 10.5 days that they stayed. So on April 1st, Medicare recognized that COVID patients are more resource intensive. So they increased the amount that they reimburse for a respiratory distress patient from $16,000 for that 5.5 day length of stay to $19,200 for that 10.5 day length of stay. So that 20% increase added $3,200 to the case rate. So 20%. But again, getting paid $19,200 as the total reimbursement that we get paid for that Medicare case, and we get paid that same $19,200 whether the patient successfully discharges from the hospital and recovers, or they die in the hospital from the COVID disease. We get paid exactly the same amount. And whether that COVID patient stays 10 days, 20 days, 30 days, again, we get paid that exact same amount. But obviously, the longer they stay, the higher the cost. Medi-Cal, commercial payers, workers' comp, they didn't increase the reimbursements by any amount. So, yes, I know there's a lot of misinformation, and people think that hospitals are deliberately coding patients as COVID so that they are paid more. But I can assure you that is not the case at Kaweah Delta. I'm very confident that other hospitals are not doing that as well. So I look back, again, those 676 cases. When you look at what we received in payment from all those different payers and compare that to the $20.1 million that it costs to take care of them, and again, it's a privilege and an honor to take care of these patients. They're our community, so I'm not complaining at all. I would have it no other way. I mean, we certainly would love our financial experience to be different, but not for a moment would I ever sacrifice the care of our community over, financial gains. But when you put the cost and the revenue together, for those 676 cases, we lost $5.9 million, which is part of that, 30-something million that that total loss that I talked about.
Okay, thank you, Gary.
And I know I'm going to get asked that question again, and that's okay.
That's right,
Yeah.
yeah. So can you please include a chart on your daily COVID report that includes the daily cases per 100,000 COVID patients and the positivity rate to match the state's new Tier 4 requirements?
Yeah, it's a great question, a great request. Obviously, our dashboard is all about Kaweah Delta. So we have a tremendous amount of information about our own hospital and the patients we take care of. And so our dashboard does report, the positivity rate of the tests that we do and the number of admissions, the number of cases that we have, the payer mix of them, the length of stay, the ages of them. We report all of that. But the information that this person is asking for is really at the county level. And I go to the county website to get that myself. So I don't think it's probably something that Kaweah Delta is simply going to pull off the county website and put it on our website, although I do understand the convenience of going to a single website. But it's pretty simple to go to the county website. It's covid19.tulare.ca.gov. And you will, it's also a dashboard type display, and you will see the latest 7-day positivity rate that the county is measuring and what is being captured by the state. And then you'll also see the number of new daily cases per 100,000 population. The state updates the statistics every Tuesday, and that's where they make their determinations of who gets to move from one tier to another. And you actually have to satisfy both measures to move out. So right now, as of today, this was reported by the county at 9 a.m. this morning, Tulare County's positivity rate has dropped to 6%, and it has been there. So if you go to the state website, which I did just before I came here, it actually shows that Tulare County qualifies for movement into Tier 2 for its positivity rate. But unfortunately, our number of daily new cases per 100,000 were at 9.2 over these last 7 days as of today. We need to be below 7 for a 14-day period. So 9.2 obviously is above the 7. But to put that into some context, right now about 45 people are contracting COVID every day, or they're being reported as positive every day in Tulare County. That's the average per day. We have to get to 34 or below. So we got to move from 45 new daily positive cases down to 34, and we got to hold that for a period of time, keep our positivity rate down, and if we can do that, we move into Tier 2, and that means in-house dining. It means the lifestyle center gets to open up, theaters get to open up. It is a huge move to go from the widespread Tier 1 to the substantial Tier 2.
Okay, thank you for that. So I'm going to give you the warning right now. We have 17 minutes, and we have quite a few questions. So
right.
We're going to start going through these.
Rapid fire.
Yes. So do you have information on whether the people hospitalized with COVID-19 at Kaweah Delta had pre-existing conditions?
Yes. The vast majority, I don't know if I can say all, 100%. Clearly, all of the patients that died of COVID in the hospital, and I would say the vast majority of people that have been hospitalized had at least one underlying chronic disease, or what we call a comorbidity. So the most common are uncontrolled hypertension, uncontrolled diabetes, people with chronic respiratory problems like asthma, chronic obstructive pulmonary disease, congestive heart failure, obesity is another common comorbidity that we see. So I always caution people that have those chronic conditions that they need to be extra careful, They need to be extra safe because they're more vulnerable to hospitalization and to potential death.
Okay, so on Instagram, on that same topic, the question has come in. So we have high obesity numbers in our county, which causes more health complications, which you just mentioned. So why isn't more focus on healthy, why isn't Kaweah Delta focusing more on healthy lifestyles and choices?
Well, I think we are. Definitely we're moving more and more to population health management, focusing more on preventative care and health and well-being. We're a designated medical-based fitness center. And if you go into the Lifestyle Center, we definitely have our share of bodybuilders that are there, but we have a lot of folks, obese, overweight, that are working hard to improve their health condition. So our clinics focus a tremendous amount on preventative care, working with our patients around lifestyle and eating, and there's certainly more we can do. I mean, in our own cafeteria, we've significantly changed our offerings to be much more healthy choices than we have in the past. But there's always more that can be done.
Okay, thank you. So are you able to let the community know how many successful COVID-19 extubations the hospital has had?
Yes. So of those 904 admissions that we've had since the beginning, 103 of them required intubation, meaning they had to go on a ventilator to help them breathe. Of the 103 that were intubated, 30, or about 29%, were successfully weaned off the ventilator. Unfortunately, the other 73 were not able to be weaned, and they passed away.
Okay, what is the total number of COVID deaths that we've had here at Kaweah Delta?
So again, to offer perspective, the county's reporting 263 deaths since the beginning of the pandemic. 146 of them died at Kaweah Delta Hospital, and about 119, almost 50% of the deaths were patients that were residents of nursing homes.
Okay, thank you. So why are doctors telling people who've had COVID-19 that they are immune for 4 months, even if it isn't true?
Yeah, very disappointed to hear that. I'd be even more disappointed if I heard that that was a Kaweah Delta physician that was making that statement, because there really is no scientific evidence that that is the case. Mm-hmm. We all hope that there's immunity, but there's no support of it at this point in time. In fact, we have tested about 3,000 of our employees, somewhere in that neighborhood, for the presence of the antibody. We did that a number of months ago when that testing first came available, and that antibody test essentially shows that if a patient was infected at one time, had COVID, but now has the antibodies in their system to potentially provide that immunity. So we had a number of employees that absolutely had the COVID virus, had a very strong form of the virus, but then months later took the antibody test and tested negative. And we're scratching our head. So either some people don't develop antibodies, or the antibodies may not stay with us for that long. So there's so much still to be learned.
Right.
And so I have not heard anybody say something like that, because there's no foundation for it right now.
Okay, so on Instagram, the question's being asked, why isn't there more antibody testing available to determine how much spread we've already had in the community?
There is. Yeah, in fact, anybody that wants to get tested for the antibody, just either, again, call our hotline or call your physician, and they can order an antibody test, and we'll be happy to do it.
Okay, so the question is this: why aren't the second rounders being reported they get COVID not long after recovering the first time?
Yeah, I don't know if we've had any second rounders, and I'm assuming that means somebody that's got it twice, that they had it, they recovered from it, and then they contracted it again. So I don't believe any of our physicians, any of our employees, I have not heard of anybody in Tulare County. I think I first heard about that reported out of Hong Kong. And I believe what they concluded is that the virus, as most viruses do, they mutate, and that the second version that this individual contracted actually was a mutation of that first version. So, yeah,
Okay.
I don't think we've had any second rounders.
Okay, thank you. So Kaweah Delta was struggling to find nurses before the pandemic. What does the workforce look like now?
It looks a heck of a lot better, no doubt about it. First, getting back almost 400 of your employees that had contracted the virus that were at home, having to quarantine and recover. All but 30 of them are back, and many of them were nurses and LVNs and CNAs and other frontline workers. So having them back, and we're delighted, and I know they're delighted to be back. That certainly has had a positive impact. We've also had some great success in hiring and recruiting new nurses. So just since March 1st, which we'll say is the beginning of the pandemic, we have hired 206 new bedside nurses, 170 of them external hires, experienced nurses that wanted to work at Kaweah Delta, and then another 36 new graduates that we've hired. We have 19 more nurses that are just waiting for their pending start date. And just to put that in perspective, so that's just from March 1st to now. In all of 2019, we hired 218 nurses over that 12-month period. So to hire 206 in really about a 6 or 7 month period, we're really excited about that.
Okay, thank you. What is the timeline for a COVID-19 vaccine to reach hospitals?
Well, that's the $64 million question. I can't say that definitively. I mean, obviously it starts in the laboratory. It has to begin with the scientists developing a safe and effective vaccine, but that's just the starting point. I understand there are about 21 logistical steps that occur between that laboratory and the inoculation in somebody's arm. So just, all the things around mass production and distribution, and how do you get it, to the healthcare workers that will administrate it. The vaccine that's being developed by Moderna, which is in the 3rd phase of development, requires that it be stored in a refrigerator that is kept at minus 70 degrees. So how do you transport, a vaccine that has to be stored that way? So I know hospitals like us, we're already planning for it. Actually, we're looking for those minus 70 degree refrigerators right now. But what will be interesting is there may be multiple vaccines on the market. And so which one do we take? That will be a decision that needs to be made. And will it be a single shot, or will it be a 2-step where you have to get that first shot and then a booster? So we really don't know yet.
Okay, thank you. Will Kaweah Delta be allowing visitors anytime soon?
So we are constantly reevaluating our visitor policy. It was one of the most difficult things that we ever had to implement it, but again, it was for the safety of our patients, our staff, our visitors. There are exceptions now that have been in there from day one. So certainly somebody that's coming in for a major critical surgery like heart surgery or neurosurgery, patients that might be developmentally disabled or cannot communicate for themselves, we allow a visitor in that circumstance. A delivery of a baby, we allow both mom and dad. Obviously, we allow mom to be there, but definitely the significant other is allowed. So, and then just a few months ago, giving our ICU, which obviously critical care patients who we can really benefit from having a family member to help us communicate with that patient. And so we now allow the charge nurse the discretion to allow visitors there. But just given that the pandemic seems to be subsiding a bit, we, in all likelihood, in just a few weeks here, maybe a couple weeks, that we are going to start allowing every patient to have one visitor. Probably restricted hours. It has to be a unique visitor, so we wouldn't have multiple visitors rotating throughout the day. So kind of again, we want to protect our patients, our visitors, and our staff. But we also recognize that having a visitor, having a loved one there, greatly benefits the healing process, and it actually makes a doctor and nurse's job so much easier. Because oftentimes, it's difficult communicating with the patient, but a spouse that knows their history and is, can give that patient comfort, and they feel confident with them, that actually helps us. So we really want visitors back, and I think we're gonna start seeing that in a couple weeks.
And are those rules the same across our facilities, the ED, inpatient rooms, rehab hospital?
Yeah, the ED and the acute medical center units, they pretty much mirror each other. Although the charge nurse in the ED does also have discretion under the circumstances to bring a visitor back into the exam room, even if they don't fall into one of those criteria. The rehab hospital, probably more restricted because it's more congregate living there. But they allow family members that are participating in training, with the patient. They allow them in, but again, exercising, all the protections and precautions.
Okay, thank you. So some gyms are already open in Tulare County. Why isn't the Lifestyle Center open?
Because we're following the law, following the regulations. So gyms are not supposed to be open. That you can't open until you move into Tier 2. But we do know that there are gyms that have opened, and we've made a conscious decision that we're going to strictly follow the governor's executive orders, and which essentially are law right now. We certainly can't wait to move into Tier 2, and we're already prepared to do that when that happens.
Okay, thank you. So what effect will the flu and cold season have? And do you have a prediction on how bad the flu season is going to be this year?
I actually think we might have a lighter flu season. If we continue to exercise these great behaviors, we don't generally wash our hands frequently and wear masks and socially distance during flu season, but it's all likelihood we're going to continue to do that. We always look to the southern hemisphere of the world, so New Zealand, Australia, they just finished their flu season. They had a very light flu season, and they attribute it much to just the practices that I just mentioned. So I actually think we have a high likelihood of having a light flu season, which would be really good. But we do know in the winter months, the cold drives us in, holidays cause us to gather, so we're really going to have to discipline ourselves, which is going to be really, really difficult.
Okay, so in that same topic, is there any way that getting the flu shot might either positively or negatively affect a potential COVID-19 infection?
I don't know. I've read things that said it might. Again, I don't think there's scientific evidence to prove that it will, but don't let that be your deciding, factor. I mean, get a flu shot. We really encourage people to get flu shots. We know they're highly effective. Even some years when they don't have the same effectiveness, they really can diminish a person's reaction to if they do contract the flu.
Okay, so we have 2 minutes, Gary.
Okay.
So what is the status of elective surgeries? We have a question that's come in. Are we able to do more surgeries in order to help the financial health of the
We are.
district?
We started elective surgeries back on May 18th, and there have been 4 different dates between then and now that we've been adding new cases, particularly on the inpatient side. So April, obviously was a very, very low month, but we were excited to start back in May, and we are almost today back at pre-COVID levels. So we're not all caught up yet, but in fact, on October 6th, I think next Tuesday, we will again increase the number of elective inpatient cases that will allow to be done every day.
Okay, so we are out of time, but I want to remind everybody who is online with us that the questions have been received and we will get written answers published, although we aren't able to cover them live right now. They will be answered and will be published. So I'm going to let you close this with a farewell, Gary.
Yeah, and I'm sorry we ran out of time. I do, again, appreciate everybody taking time out in their evening to be with us. Hopefully we're able to answer a lot of your questions. We really appreciate that you kind of look to us as your source of information, and we take that responsibility very, very seriously. We prepare extensively for these evenings. I invite any of you to join our bi-weekly community engagement telecasts. We do them every other Thursday. They're an hour long from noon to 1. I address many of these questions. In fact, I might take the questions that I wasn't able to get to tonight and address those. We'll have our next telecast think, next 2 weeks, 2 weeks from today. So certainly invite any of you and just reach out to Deb Volison or Laura Flores, and they'll get you the contact information. But again, thank you. Thank you for supporting of Kaweah Delta. We greatly appreciate it, and have a wonderful evening.